Hello, my name is Ray Schaffer. I'm from Calabasas High School, and this is the impact of environmental injustice on the global health of Indigenous peoples. So here's my self-introduction. I'm a rising junior, 11th grade at Calabasas High School, and I'm a resident of Calabasas, California. I'm involved in many activities and extracurriculars, one being Malta United Nations. Here I compete in various competitions around California. And I'm also the president and co-founder of the Roots and Shoots, which is an environmental club of our school. We do many things such as creek cleanups and trail cleanups. And I'm also part of my city's environmental commission. And finally, I'm the president and co-founder of my nonprofit, which is called P22 Environmental/Wildlife Awareness. And in the future, I'm interested in the field of global health, and more specifically, global environmental health. I want to contribute to solving environmental issues that impact people all around the world. So here's the table of contents of the health-related issues that I'm going to be covering today. First, I'm going to be covering genetic disease, and then I'm going to be covering reproductive injustice. After that, I'm going to be covering displacement and safety, spiritual health, and then sanitation. So to start, let's look at the context of this issue. So what is the larger significance to this issue? Well, in an interview conducted by Melinda Janko, Royce Lambert, who is the former Chief Judge of the United States, stated that incidents of cultural genocide against the Indians are merely the echoes of a horrible, bigoted government past that has been sanitized by the good deeds of a more recent history. So in simpler terms, Lambert is saying that Indigenous people all around the world have suffered a history of oppression brought by governments, and currently an example of this history is the environmental injustice that Indigenous communities face. This leads me to my guiding research question. How do Indigenous communities around the world face environmental injustice, and what health-related consequences do they endure as a result? So what is environmental injustice? Well, this is a type of injustice that results from pollution, climate change, and industrial development. However, these issues that are faced by Indigenous communities are not primarily caused by them. They're mostly caused by corporations, businesses, and most importantly, governments that allow this to happen. For example, this graph from Statista shows that Indigenous communities actually protect an astonishing 80% of the world's biodiversity. This shows that they are making a strong effort to maintain the sustainability of our environment. So now let's look at the real impacts on Indigenous people's health. So there are a multitude of issues, health-related issues that are faced by Indigenous peoples because of the environment. A main one is genetic disease, and this is where I've done a little bit of my personal research. So an example is the Lakota tribe, which is located in the northern plain regions of America. So using public data, I've put together two bar graphs that compare cancer mortality rates in this region of the general population compared to the Lakota tribe. So here from a study, it is shown that mortality associated with cancer is 40% more prevalent among the Lakota tribe compared to non-tribal people inhabiting this region. Now, also recently, it was found that this disparity might be linked to polluted waters from government-run uranium mining next to the tribal lands. Now, clearly, the Lakota tribe has been suffering the environmental harm that they had no contributions to, resulting in environmental injustice. Another health-related issue is reproductive injustice. Here are some examples from Canada. First, the Amjiwanong tribe of northwestern Canada. They're located next to 40% of Canada's chemical factories, and since 1982, this tribe's ratio of male births has decreased from 0.5 to 0.3. And another example is the Akwesasne tribe, located in eastern Canada. After three aluminum foundries were established upstream of one of their rivers, hydraulic fluids leaked into this river, leading to a disparity of PCBs among Akwesasne and the general U.S. population. And another health-related issue is displacement and safety. Here are some examples from South Asia. First is the Kalas tribe of northern Pakistan. Here, 5,000 people are at risk of death and displacement due to climate change, deeming 33 of their lakes at high risk of bursting. And another example is the Munda tribe, located in Bangladesh. By 2050, this tribe is estimated to be fully displaced due to climate change, putting their entire residents at risk due to coastal flooding. And now the fourth issue is spiritual health. Here's some examples from the United States. First are a bunch of Western tribes. Now, herbicide treatments from the government to counter invasive plants by the U.S. Forest Services has resulted in the decline of cultural plants that are used for spiritual purposes by these Western tribes. And another example is the Standing Rock tribe of North Dakota. The construction of a government-funded pipeline called the Dakota Access Pipeline puts their ancestral burial grounds at huge risk of contamination. And the last health-related issue is water and food sanitation. Here are some examples from Latin America. So some tribes, since 2007, have faced increased spreading of waterborne diseases such as malaria and dengue due to diminished water quality from climate change. And now, currently, 10% of the Latin American economy is based on subsistence farming, with many tribes participating. However, climate change has currently put food production at risk. Now you may ask, how do we solve this issue? Well, there's a prime example from the Guarani tribe of Paraguay in South America. So their issue was that the government and oil companies in Paraguay were looking to construct a pipeline that would pass directly through their territory, and if bursted, would contaminate the entire tribe's water supply, which would pose various health risks. However, they solved this issue with assistance from the Wildlife Conservation Society, which is an international organization. The Guarani tribe, with help from this international organization, was able to negotiate with the Paraguayan government to move the pipeline to an area away from the reserve that does not pose any risks. So how can we implement this in society? Well, we need other international organizations like the Wildlife Conservation Society to assist other indigenous groups in successfully mitigating environmental issues by talking to corporations, businesses, and governments. Here are my references. Thank you for listening, and here are my socials.